Welcome to I Can't with Dr. T, a place where we share in discussions, affirmations, and learning moments. You can reach us on social media at Dr. T Medley, that's at DrTmedley, on Facebook, Instagram, Twitter, and TikTok. You can reach us on the web at www.drtmedley.com or by email at info@drtmedley.com. That's info@drtmedley.com. Welcome to the show. Hello. Welcome back to I Can't with Dr. T. We're so excited to have you back for another episode. And essentially, this is another episode in our informal series of Boss Women of Worth. So we're going to be talking to a fellow clinician today about some of her work, and I think you're going to enjoy it. So as always, I thank you for being here, for joining me, Dr. T, on I Can't, where, we talk about issues that are important to you, a variety of musings related to womanhood, familyhood, therapy, and the importance of mental wellness, as far including diversity, equity, and inclusion topics that are areas of passion. And so, again, we're just going to add this episode to our really valuable series that I know is going to bless you immensely. So call your therapist friends, call your non-therapist friends, call everybody that you're cool with, let them know all the gems that you're going to get from today's episode. So let me introduce to you who our guest is for today. Today's guest is Dr. M Dainty, who's a fully licensed professional counselor in the state of Texas and a board-approved supervisor for LPCs. She operates a private practice in Fort Worth, Texas that focuses on trauma-related problems and brokenness using EMDR. And we'll have her talk a little bit about EMDR, what that is, how it works, how it can benefit you. Additionally, Mary works for Baylor Scott and White All Saints as a PRN intake and assessment clinician, and is also an adjunct professor at the King's University in Southlake, Texas. Now, when Mary's not working, she loves to spend time with her husband and her son. She cherishes the moments to just sit and connect with the people that she loves. Her favorite pastimes are when she can sit outside with a warm cup of tea and chit chat with friends in the court, traveling to see friends and family, and any opportunity where she can sit on the beach, curling the sand between her toes. So please help me welcome Dr. M Dainty to our episode of I Can't today. Welcome. How are you?
Good afternoon. I'm good. Thank you. Thank you for having me.
Yes, you are very welcome. I'm excited about our conversation today and an opportunity for us to connect again, because we stay so busy that often it's hard for us to have time to connect. So kind of selfishly, right, this podcast episode is an opportunity for us to get a chance just to talk and chit chat a little bit, right?
I agree.
So I definitely want to share with the audience a little bit about how we ended up sort of connecting professionally, because, I think fate is very important. And I'm at a point in my life where I'm really trying to be very intentional about connecting with people who match my energy, who match my areas of passion. And so I definitely think it was no coincidence that our paths crossed just a couple of years ago, actually. And so I don't remember all of the pieces, and so I'm going to allow you to add and fill in where you would like. But I remember getting an email from you saying that you were looking for someone to come and do a guest lecture for one of your classes at the King's University, a class for counselors in training, and you wanted a diversity, equity, and inclusion topic for these counselors in training, which I was so very gracious to do, because I think it is important for counselors in training to have a really good broad understanding of diversity, equity, and inclusion topics. And so I was so happy to receive the invitation, and I really enjoyed the time with your class, and just sort of hearing feedback from them about how they took in the information and their questions. But if I'm not mistaken, that's where our paths initially crossed. So please do share your side of that story, or any additions you have to it.
It is. Yeah, you pretty much nailed it. I remember, dialing back the clock just a little bit more. Your name had triggered my radar several other times. I think I had maybe even attended a CEU that you had done. And I knew your breadth of knowledge was so good, so intense. And so when I was asked to teach the class, it was right in the middle of COVID, and students were transitioning to the telehealth platform, video platform for class, and it was going to be a very different experience altogether. And when we approached the section of cultural diversity and inclusion, it just came to mind, you know what, I'm going to reach out to Dr. Medley and see if she'd be willing to just spend 30 minutes or an hour with us. And when you said, hey, I could talk longer, I think you talked for 2.5 hours, I was just like, oh my gosh, this is a dream come true. And my class was just thrilled to hear everything you shared with them. And ever since then, sort of like you said, I think it was just fate. It's a chance. I could have not emailed you, and I could have done my own version, but I'm like, why not? That was such a small risk to take, to reach out. And had you said no, it would have been okay. But thankfully for all of us, you said yes. And
yes.
And then we stayed in touch ever since.
Right. It was just meant to be, right?
It was meant to be.
It was awesome. So on that note, I'm very thankful that you've taken time out of your busy schedule to share with us on this episode, because I know that there are some very valuable things that you do clinically that I think listeners would gain some useful information from, and things that may even benefit them in their personal lives that they may not have considered, things like EMDR, for example.
Mm-hmm.
So let's talk a little bit about the work that you do, right? Your focus is trauma and brokenness. And, a lot of times we use words and they mean something to us, but they mean something different to other people. Mm-hmm. So I'd love for you to define for us, when you say that your specialty is trauma and brokenness, what does that mean? What does that really look like, right, in a person who may be experiencing that, to where they would know, hey, that's me, right? Maybe she could help me.
Yeah, I think that's a good place to start. Trauma is such a loaded word because it means something different to everybody out there. Some of us would categorize trauma as something very big and catastrophic, whereas others may view it as being a 7-year-old and traveling cross country and losing your favorite bear on the subway. And so you have these different levels of trauma and brokenness, but really when it boils down to it, it's an adverse experience. It's an adverse experience that could have resulted from childhood disappointment, dashed expectations, heartbreak, guilt, failure to achieve goals, abuse, poverty, food insecurity, witnessing violence in the home or the community, growing up around substance abuse, living in a home where there's current substance abuse, societal pressures for gender roles, rejection, death, loss, school shootings, and watching the news on a loop. That is, I think, within the last 3 years, something that has increased the level of vicarious trauma that the world is feeling. And so the result of all of these adverse experiences is a sense of brokenness, where a mark has been left. It can result in physical, emotional, verbal, or vicarious felt issues. During pregnancy, we don't think about trauma sometimes in this way, but trauma experienced during pregnancy by a mother can also be passed down in utero, which is really, really big. This is huge. And I've got a little section where we're going to talk about that a little bit later under symptoms, but trauma is a giant spectrum, going from disappointment and heartache to catastrophic in nature.
Wow. Yeah. Oh my gosh. So I totally agree with all of that. I know for me, the definition for trauma that I use is pretty broad. And I often find that, there are a lot of people who, if you ask them, like, have you ever experienced any trauma? They probably say no. Yep. Right. But if they heard you go through that list that you just went through, their eyes might open a little bit wider, right? And they would say, oh, okay, yeah, maybe I have experienced trauma at some point, right?
Yeah.
Because I think for many of us, we grow up having a particular definition of what trauma is, and we feel like it has to be something just so drastic, or it has to be something that is explicitly life-threatening in order for it to be traumatic.
Right.
And definitely it doesn't have to be either one of those to qualify as trauma.
Not at all.
And to essentially have a trauma effect on us, right? A traumatic effect on us.
Right. And trauma isn't bound by time. So a lot of clients or patients that we see in the practice are under the impression that, well, it happened 10 or 15 or 20 years ago. So how can I possibly still need to process something that is that old?
Right.
And so somewhere along the line, whether it's, we grow up with it, time is heal, right? We heal with time is what we're told. And it's simply not true for a lot of people. It just gets filed away into these filing cabinets in our brain so that it's on the ready. It's like, hey, if this happens again, we're going to be ready for you. We're going to help you prevent any more hurt. Right. And so time may be a friend in terms of maybe we pull away from that acute reaction for maybe a stretch, but time doesn't make it disappear.
Not at all. And I would say this week I've had a couple of conversations with folks about trauma and grief, right? That just because time has passed doesn't mean that it's gone away if you haven't taken the time to actually work through resolving it, right? And it's gonna pop back up if something else triggers. And again, I think, people have been taught that, well, time heals all wounds. And that's not true.
It's not true at all. Not true at all. And it's nothing new. The concept of trauma goes really far back. It would go back to the 1600s to Descartes, where he even said emotions are completely influenced by external stimuli that we're presented with. And then Freud and Brouwer said, their whole concept of shock and hysteria is caused when a person reminisces and their protective layer, their outer protective layer is split. And so it results in a heightened anxiety to try to take over and keep you on guard. So the concept of trauma is very old, but thankfully, in the 1990s, researchers really started to dig into the concept of, we have to figure this out because this isn't getting any better. We think 1600s to 1990, and we're still, it's taken this long for us to process through really how big trauma and brokenness is.
Yeah. So let's talk about, it's not going anywhere, right? People will continue to have traumatic experiences, to have experiences in their life that may lead to brokenness. And so what are some of the solutions? What are the ways that, as a clinician, that you help folks to deal with it, and things in general that you recommend that folks do to, work towards healing themselves in some way or maintaining that progress in healing, that journey of healing. But things that can help for folks who are thinking, well, this is never going to get any better, or, you know, what's the point of going to therapy and talking about that old stuff, right?
Right.
What does help?
Yeah. So the good news is you don't have to live with this forever. There is help. So at any point in time when you've experienced disappointment, disaster, trauma, whenever you're ready, there are lots of techniques and methods to addressing it. Everything from the really, like what I would call crunchy, organic, dip your foot into the pool, therapeutics to medication. I'll circle back to this because otherwise I think I might get on a little soapbox with it. But treatment implies that something is already wrong, and whereas prevention is a key to helping treatment not become such a go-to for as long as we need to tap into it. So thankfully now, lots of options are available. Some of the most popular are trauma-focused psychotherapies like EMDR, which stands for eye movement, desensitization, and reprocessing, cognitive therapy, and prolonged exposure. We've got support groups now, medication. Sometimes, stigma is related to medication therapy, but when anxiety and depression are so significant that you are not living life, sometimes medication, even if it's temporary, 6 months to a year while you're doing therapy, sometimes it's exactly what you need in order to move through this. All of those therapies offer a traditional clinical approach, but there are some sidecar interventions that you can consider as well, complementary and alternative, for addressing trauma and brokenness. And that includes acupuncture, massage therapy, craniosacral therapy. If you've not done that, it's really cool. Exercise, of course, exercise seems to be the cure-all for everything. Guided trauma-focused meditation, yoga, Tai Chi, and Chinese herbal meditation. So sometimes people, especially depending on your demographic or socioeconomic background, going to see a psychiatrist at $300 an hour and a therapist at $150 an hour just isn't financially a possibility. So tapping into things that are more natural are where people want to start. So I don't know about in other areas of where your listeners are tuning in, but in Fort Worth, we even have a community acupuncture center, which allows you to pay what you can afford within a spectrum. And so you can, I think the most you can pay is $65. I think that's her top top tier. Yeah, Pam Durham. She's really awesome. She's accessible, and she's good. She's thorough. And so, there is something out there for everybody. Sometimes you just have to search really well for it. There are lots of free YouTube trauma-informed yoga videos. Yoga with Adrienne and Carleton University are really great places to start. And NAMI, NAMI stands for the National Alliance of Mental Health, or on Mental Health. They offer free support groups, and they have a search tool for people to be able to tap into that. Yeah, some other really low cost resources. Dr. Mark Grant has 4, I believe, EMDR based apps for your phone. They cost $4.99. They're yours forever. Once you buy them, they're yours. And they focus on being calm and confident, anxiety relief, pain relief, and sleep restoration related to trauma. And these are really awesome guided EMDR tracks that people can tap into. Now, even Spotify, it might be Pandora, I have to go back on that. They have an EMDR channel where, as long as you're wearing headphones or earbuds, you can listen to music that is distributed in a bilateral stimulation way to help you tampen down the feelings of anxiety and trauma, which is really, really cool.
Yeah.
For trauma related to affairs, spousal infidelity, there's a really great website called affairrecovery.com. They offer a free affair analyzer, and then they offer what's called a 7-day kind of do it on your own, figure this out process. To me, the 7 days, it really should be 7 weeks. The topics are very heavy, and unless you're not working and don't have a family, you really want to take it slow. I have found 7 weeks is really more beneficial. And that kind of work deserves to be done really slowly and gently. Yeah. And then, of course, there's the self-help books. The Body Keeps the Score. The audiobook is pretty good because the book is pretty hefty. It's a deep read.
Yeah.
And sometimes when you start reading all the science, if you're not academically orientated to want to like research some of that stuff, you might just sound a little boring to you.
Right.
And then Open Path. Open Path is a phenomenal resource for people to find low cost and sliding scale mental health providers. I wish their advertising budget was more, because I think if people knew that they were out there and that they could find providers that are qualified, that they would be using it. I really do. So there's a lot of free, low cost, and then traditional types of interventions that a person can consider when they're looking to, kind of work through those problems related to trauma and brokenness.
Yeah. And thank you for sharing all of those resources. I was trying to take notes as you were going, some of the things that were
I'll send it to you.
that were newer. Like, oh yes, we need to include all of this. Because I think, so many, I hear from people all the time, like, oh, finding a therapist is so hard, and how many challenges they experience with it. I'm like, there's help out there, right? And they take a little bit of legwork to find the resource that's the best fit for you, but I promise you there's resources out there. So sometimes having, those targeted resources and links for people just to make it a little bit easier for them to get to the help, maybe a fewer steps to get there, can be useful. And I had a recent conversation with sort of like a mentee who had previously been in counseling. And what she said to me was, well, yeah, I went for a couple of sessions, and then it did help. And I started to feel better. So I didn't feel like I needed it anymore. And I stopped going. And I said, well, why did you stop if it was helpful for you? I said, that's the time to keep going, right? I said, if you got to a place where you were starting to feel better, I said, that's what therapy is supposed to do. I said, now you actually have the resources to do the work that's required in therapy now that you're feeling better, right? And I said, there are so many people that I've heard that from who stop going after a few sessions because they notice they're feeling better. And I said, as therapists, perhaps we need to do a better job of helping folks to understand, right, that yes, you should feel better, right, after a few sessions, but that's when the real work starts, right? Because if you come in crisis, or if you come in when you're overwhelmed, which is when a lot of our clients come in, right, because there's just something so heavy that they're dealing with, and then you start to feel better, guess what? Now you actually have the mental resources to do the work necessary to get to true healing. So who knows, at some point I'll focus on like, what do we need to do as therapists to make sure that we're all doing that? But what are your thoughts about that? How do you help clients understand, hey, this is a process, like this isn't overnight necessarily. Yes, you should feel better early on, but the real work comes as we continue to work together.
Yeah, I think what you said is really interesting, especially for those of us who work with trauma or brokenness or emotional repair. The amount of change that our clients feel is so significant that to them, it's almost like this is the first time I felt different in a healthy way in X amount of time, years.
Right.
And I think there's a renewed sense of exploration with this new change that they're just really eager to jump into. And so generally, I do have that conversation with all of my clients. I say, if you scaled your anxiety at a 9, I said progress would be if we could get you down to a 6 or a 7 initially, right? And I said, and you're probably going to feel like you want to stop coming, and that's okay. I was like, enjoy that time and enjoy that period of using your new skills, because ultimately, most likely what's going to happen is with time, you're going to realize, okay, the skills that I just learned, the knowledge that I just gained has only taken me so far, and I still want to feel better. I want to feel even more better. Even better.
Right.
Because now there's this sense of renewed hope that, whoa, that made a really dramatic impact. So if that worked when I was that bad, imagine what could happen now if I go back and finish. And so almost always, I ask people, I say, give me a minimum of 6 to 12 sessions. I'm like, stick in with me for that long. I will make sure I maximize the time I'm with you. I will make sure we try not to waste that time. We will just get right in there and start doing the work. I said, but I want you to stick with me for that long. Because even if you never come back again, you're going to most likely feel better than what you did coming in. And generally what happens is, for the people that do leave after, maybe 9 or 10 sessions, within about 6 months, I'll get a message from them saying, hey, Mary, I know it's been 6 months since I've seen you, but some new stuff has come up. Can I make an appointment? I'm like, of course you can. Of course. Let's time to get to it. Right. And so there's a part of me that it's almost it is an expectation, and I look forward to that happening, because then I know that little spark of hope has been reignited, and that either way, they're in a, whether they come back or not, they're going to be in a better place than when they first came to see me. So I don't formally discharge clients in the way that some therapists do. Some therapists are like, oh, if you don't see me, within 6 weeks, you're officially not my client anymore. I don't have that approach. Maybe that's the person-centered part of me. Maybe that's just the, I've been doing trauma work for so long that to me, I'm like, no, come back and see me. Come back. You've always got a spot here.
Yeah. Nice.
Yeah. So I think knowing that as a trauma-informed therapist is one thing. I think that's part of the puzzle. Yeah. Sharing that with our clients is the other part, and then letting them take the reins, and just hoping and wishing, because as counselors, we're just like, oh, please don't disappear, don't stop now.
Right.
We want you to get better, but also just knowing that now maybe they have a renewed sense of confidence in order to trust what's happening, and then trust that their brain and body is going to let them know, hey, we're not done yet. Mm-hmm. Let's get back to it.
Yeah, definitely. And I assume, that that's part of the way that you work with your clients, right? Mm-hmm. Learning to trust your mind, your body, your emotional reactions, right? Yep. More securely, such that, as they continue to go through life and they start to notice some of those same red flags, perhaps from before, they'll say, maybe I should go back and see Dr. Dainty, right?
Right, exactly. And to me, that's like the best test of your skills, as a client. How do you know what's really working? Well, because life has its fabulous way of, piling stuff on us all at once, and those skills are going to get tested eventually.
Oh yeah.
Yeah.
Definitely. So what else do you think folks need to know about trauma work, about brokenness, about EMDR, or their treatments that you think, this is really important for folks to know that we haven't touched on yet?
Yeah. I think primarily it comes with recognition of symptoms and not minimizing what's happening. We have a really great way as humans of, I'm okay, it's fine.
Mm-hmm.
No, I'm good. We have a way of just minimizing and downplaying the hurt that is inside us, and then not understanding really what that is. You may know somebody or see somebody that looks fine on the outside, and on the inside they're experiencing, significant depression or anxiety or nightmares. They're drinking or doing drugs when they're not working, because when they're not working, their brain's not being engaged in a way that distracts them away from their feelings and thoughts. Chronic pain and sleep disruption and startle responses and flashbacks are all related to trauma and brokenness. And when a person gets hijacked by those emotions, they're going to interfere with their daily lives. Live hard, I'll sleep when I'm dead philosophies are often what some people do in order just to get through the day and not focus on anything that could possibly break them. And as we know from the big ACEs study that was done back in the 90s, is ACEs stands for Adverse Childhood Experiences. What we know from that, it was a very in-depth longitudinal study, is that 61% of adults have experienced trauma before the age of 18. Mm-hmm. That is just 61% of the 17,000 people that were interviewed. Imagine what that number would look like if every person were to participate in that study. And so we've all got our stuff going on. And the good news is that there's help out there and you can tap into it anytime you're ready, or the people around you say, hey, it's time for you to change, because what's happening right now just isn't working for us.
Yeah, it's not working. And mm-hmm. I think some of that is connected to the stigma of mental illness, right? That makes us believe that my life has to be pretty much over before I need to go to therapy. Like, things have to be so horrible to justify me going to counseling.
Right. Yeah.
And, I tell people all the time, like, honestly, it's going to be tough for you to do real work if you wait until then to come to counseling. Like, in crisis mode, it's hard to really do healing work. But,
it is.
Counseling is for every situation. And it doesn't, mild, moderate, severe, like, it's for everything.
Yeah.
And so, there's so much more work we've got to continue to do to try to get rid of all that stigma that makes folks believe that their life has to be so horrible to justify coming to counseling.
Right. Yeah. And I think a lot of that starts with advocacy. And that's kind of my soapbox. That could be a whole nother episode, but
we may have to talk about it.
I'd love to. Advocacy of, just starting out with setting people up for handling things when it happens is approach we've got to start adopting and implementing from the very get-go. Using our words, talking about things that are hard and hurtful. Talking about those hard and hurtful things might feel really bad, but keeping them inside of you is going to have tremendous repercussions on your health, mentally and physically. Most chronic illnesses are directly related to the effects of trauma that's been untreated.
Mm-hmm. Yeah.
And so there's so much that we could be doing from a preventative, not treatment-based model. And, whether you're white, black, brown, the more we start normalizing that talking and processing is good for us, the better we'll start to become as a human race.
Yeah, I agree. Mm-hmm. I totally agree. So I want to make sure that we talk a little bit about the work that you've done with pregnancy and postpartum populations as a therapist, and how you help that set of clients as well, in case there's anyone listening who has experienced either, pregnancy related trauma or other issues that may be connected. Again,
Yeah,
how they should know when to seek help, what help is there, and
sure.
what they can do to improve their situation or what they're experiencing,
Mm.
and maybe some resources that are there.
Yeah. From a personal standpoint, uh, people who are trying to get pregnant, are dealing with infertility, maybe have difficulty in pregnancy, or traumatic births, or then even postpartum depression. These are all really significant, and a lot of times you can't prepare for them. And so it's all I always jokingly said, I never experienced anxiety until the minute I got pregnant. And then all of a sudden you're like, oh my gosh, what? I have to keep this child alive inside me. I have to keep this child alive earth side. And I was like, where is this anxiety coming from? And unfortunately, it's just one of the byproducts of growing a human being. And when I started going through that, it's when I really became interested in the perinatal, postnatal process with people who were going through this as well. And when I was taught, and I honestly can't remember where or how I was taught this, maybe just it was fate. But when I learned that trauma experienced during pregnancy can be passed down to the baby, I was like, wait, what, huh? Like, I don't understand. What are you talking about?
Right.
And then I realized it's this word, big word called epigenetics. And epigenetics, just for your listeners, is when epigenetics changes the way your body reads a DNA sequence. So it doesn't alter your DNA. However, it tells your body to read that DNA differently. So now all of a sudden, you've got this epigenetically passed down trauma that then sets your child up for risky behaviors. And we're talking like alcoholism, drug abuse, depression, smoking, physical inactivity, obesity, chronic health problems, ischemic heart disease, cancer, lung cancer, skeletal fractures, and liver disease. And I was like I needed anything else to be anxious about.
Right.
Next, I have to make sure that if I experience trauma when I'm pregnant, I need to be able to process that so my DNA sequence isn't read wrong.
Right.
And so just talk about setting a human up for such an anxiety-filled situation. That'll do it. But the good news, thankfully, is that it can all be reversed and it can be changed. That's the really good news. And so there are special clinicians out there. I wish I was one. I am not. I am in the process of working into becoming a specialist with prenatal mental health related problems. Nice. But for those that are experiencing the postpartum anxiety, postpartum depression, postpartum psychosis, it's a really good idea to tap into somebody that has that specialty, because they're going to understand that level of trauma and brokenness in a more meaningful way than maybe just somebody who hasn't studied it. So that's what I'm gearing up for next, in terms of my own personal professional journey. I've worked with that population for quite some time now, and it's remarkable. It's absolutely remarkable to know that a person's outlook can be changed through therapy, and that you're helping to contribute to reversing that epigenetic marker that was potentially put into place. Initially, when I first started, I was doing it at a pretty discounted sliding scale because, yet again, there's a barrier for accessibility for specialties. And most of the mothers I were working with were during their pregnancy on Medicaid. But then, as we know, Medicaid disappears pretty quickly after the baby is born for the mother. So there's not if you're in a situation where you don't have access to insurance, and this was before Open Path existed for open, for discounted care. To find a PMHC specialist was very difficult. And so I worked with them on a sliding scale just to get them back to normalcy. And it was wonderful. It was absolutely wonderful. Sometimes they bring their babies, and that's really sweet. And it's just you got to meet the person where they are. And sometimes when you're working with mothers, it means they got to bring their baby with them. Right. They're going to be feeding the baby. You got to be patient, and I don't know. It's very rewarding work. So if any trauma therapists out there have ever considered the idea of doing anything complementary or specialty, being a PMHC would be really cool. That's my next. The credential has kind of really gained a lot of traction in the last probably 5 years that I can think of. And now it's kind of one of those things, well, was I doing it already? Yes. But now I kind of need to legitimize myself. So that's going to be next on the horizon.
That is awesome. I mean, I can definitely see applications for this with, women who've experienced racial oppression, women who've experienced economic oppression, all of those things that, again, folks don't always necessarily consider or think of when you ask, have you experienced trauma? But definitely falls under that umbrella of trauma and has such a wide reach for so many women, right? And not realizing that, hey, these are things that can impact my baby in ways that I didn't even realize could impact them.
Yeah, it's big. I mean, it's just, to me, it's mind blowing still, even that, I work with it on a daily basis, and it's still just absolutely amazing, the impact of trauma.
So very interesting. And it's kind of funny, when you kind of started a few minutes ago, it made me think of a client who actually, I think just last week I was having this conversation with her. I work with high achieving women and those who struggle with perfectionism. And this client definitely falls within that category. And she recently found out that she was pregnant. And so, I was trying to have a very honest conversation with her about this process. And I told her, I said, I'm going to tell you, pregnancy and motherhood will activate all of your insecurities. So just prepare for that, because
all of them.
Every single one of your insecurities is going to be triggered during this process. So I want you to be fully aware of that. And she just kind of sat there and sighed.
Throw a little exhaustion in there, and you've just got this
it's a perfect storm.
Perfect storm. Oh yeah.
So yes, luckily she's in therapy. So
thank goodness. Thank goodness.
But it will be a journey for her.
Definitely. Yeah. Well, and then I imagine what's probably going to come up too with high achieving mothers is resentment. How are you? You're not supposed to feel resentment because you have a baby inside you, but now all of a sudden you can't do the things you used to do or travel the way you used to travel for business. It's a normal emotion, but you need to talk about it. You need to talk about the things that if you talked about with your friends, they would look at you like, oh, you're a bad person.
Right.
when you're talking with somebody who's worked with trauma or brokenness or, perinatal mental health, you're like, oh gosh, yeah, that's huge.
Yeah.
You asked for this. You wanted a baby.
Right.
And now it's completely disrupting your life.
It's disrupting everything. Yeah.
Everything.
Yeah. And you see the pictures and the commercials and all the cuddly stuff. But yeah, there are times where you may not really like this little person very much.
Correct.
Yeah. And it's hard to acknowledge that sometimes.
Age 3, that for me, it was age 3 when my son was 3. I was like, now I know why mothers eat their young in the wild. Like if I could get through age 3, then I will have succeeded. But yeah.
And you made it through, right?
Yes. By the skin of my teeth.
You made it through. Oh, well, on that note, that's actually a very nice segue to how do you balance it all? How do you balance being a therapist and a mom and a wife and a professor, learning new specialties? Like, how do you do it all? What are the tips that you have, the keys for you and tips that you have for others out there who are juggling a variety of things all at once?
Oh goodness. Honestly, more often than not, I'm really good at juggling it. And balancing it. So juggling is a heavy word. I shouldn't say juggling. Balancing it is a better reframe of that. Sometimes I'm really bad at it because in the end, I'm human. I've learned that the balance for me was stress and mom guilt. And so for me, it took me a little bit of time to figure it all out, navigate it all. And here's what I've learned about myself. Because I always tell people, talk things out loud. You might look crazy or feel crazy. I know crazy is a heavy word for mental health, but I'm using it in a casual way. Put on headphones and pretend like you're talking to somebody on the phone if it helps you feel better. But talk through these things out loud so that you can hear yourself saying the words. But what I have figured out is during the school year, which is generally mid-August through late May, I have to stop seeing clients around 3 p.m. in order to be present as a mom and a wife. Does it impact me financially? Significantly. It does, because most people want to see you after work. But for my sanity, it's what I have to do. There are times when I make accommodations to see people, and I tend to do it in a cluster. And then I quickly remember why this isn't a good idea for me. While I want to do it, it's sort of like the pregnancy talk, right? While I want to do it, it's just not good for me to sustain that. So I have to remind myself, okay, there's a reason why you put this kind of boundary in place for yourself. And so, but sometimes I have to live through it in order to relearn it and reinforce it. And that's okay. That's how we get through life. Thankfully, for me, I've kind of always prioritized my family. However, they've not always come first. Because sometimes there are situations in which I'm required to do things, like all counselors. I'm required to do things to make sure my license is current and that I'm doing my CEUs. And sometimes that is going to interfere with family-related things. So when those things do happen, I give myself grace because it's not an everyday occurrence. It is a one-off occasion. But when it happens, I've had to learn that anybody in any other profession would be experiencing the same thing. And my family knows that I love them because I tell them. Thankfully now my son is old enough that he doesn't need me or want my undivided attention all of the time. It was a really bittersweet shift in parenting though, right? It's like we want to raise our kids to be productive human adults. And then they don't need us, and we're like, oh, wait, what happened? What happened? I don't like this. But we've taught our son how to be very self-sufficient, and it's so beautiful to see. But at the same time, there is a sense of like, do you want me to help you with this? And he's like, oh, I'm good. I'm like, okay. Um, so, I it's taken time, but I've learned to, some things have to sacrifice in order for me to have peace. And while that peace isn't guaranteed 100% of the time, I would say that a good 80% of the time, I feel it. And so in turn, what that does is help me be a better mom, helps me be a better teacher, a wife, and a better clinician. Because I don't need to be bringing my junk into all of those other situations. That's the last thing you want your therapist to do. And so I've worked really hard on working through the stuff myself. Sometimes I get it right. Sometimes I don't.
Yeah. And I love the fact that you are willing to acknowledge that, right? Like sometimes I'm good at it, and then sometimes not so much. Because definitely, for my high achieving perfectionist population, we have a hard time acknowledging that, hey, it's not always going to be perfect. It is okay. And that piece about offering ourselves grace when we need to, like, I may not be able to get it all done. And that's just the reality of the situation, right?
Yeah. I'm a type A minus. So that's how I categorize myself. I'm a type A minus.
I love that.
So for all of you out there that aren't as, quite, fitting into the type A personality, I'm still there, but that grace has allowed me to add that minus in there. And being kind to yourself, man, I tell you, speaking words of kindness over yourself is so important. And I don't mean necessarily like words of affirmation, because those are great too. But I think sometimes they can kind of become kitschy, I'm a good person. But really having a good conversation with yourself, like, dadgummit, I'm working hard. I need to stop. I need to stop with this. I can't be everything for everyone at all times.
Yeah.
And just admitting that and giving yourself some grace is one of the most important things you could possibly do.
Yeah. And, I can definitely confirm that Dr. Dainty, in fact, does this, because as we were trying to schedule the recording for this podcast, Mary's like, look, we're going on vacation. And so I got to reschedule. I was like, I love it. I love it. Because so many of us therapists, we will work, right? And we put the self-care and the family and the rest and the recharge time on the back burner. So I love boundaries, and I'm trying to improve my own personal boundaries. It's been a great experience over the last year or so, just sort of, being more consistent with those and doing more to enjoy life and take vacations, which actually I'll be taking this week. So it feels good to be like, okay, it's not going to get done, but the world is not going to stop spinning just because a couple of your tasks aren't getting done.
It's been going since the beginning of time, and it's not going to stop for you.
Right. Like as though I'm so important that the world will stop for me, right?
Oh my gosh.
We say things to ourselves that just really don't make sense.
We're good at justifying stuff. Right. I mean, overachievers, and I mean, any of your audience will get this. We feel our best when we are producing. We feel our best. That's the Achilles heel of it, is that we might feel overwhelmed, but we also feel really engaged and charged by these feelings of completion and success and control. And we're like, this is a good feeling. Why would I want to get rid of this? But the stress that comes with it is so much.
It is.
Those
reward centers are just going off. Yes.
Like dopamine, too much dopamine, not enough.
Yes, all the things.
Yeah.
Well, is there anything else that you'd like to share with listeners that we haven't had a chance to get to, that you want to make sure to share with them about your areas of specialty, EMDR, the work that you've done, general mental wellness tips?
Yeah, while my focus is EMDR and I love it, I also know it's not for everybody. So find what works for you. What works for your best friend may not work for you. And don't be discouraged if the first, second, or third person doesn't work for you either. There are over 1,000 theories for managing mental health. In that journey, you're going to find some of them are like not going to align with what you want in life. And so just you owe it to yourself to find something that really understands you and meets you where you are. And when you find that, dig in. As my son will say, level up. It's time to level up.
Nice.
Like, get to it. You owe it to yourself to be the best version of you. And there's now that we're in such a great time where sometimes resources are very difficult to find, but they are out there. And it might take a little bit of work, but you're worth it. Everybody listening is worth it. The amount of compassion and grace and love that you will feel for yourself is going to be restored and renewed.
Yeah, I totally agree. Well, definitely let folks know how they can find you or get in touch with you. If there are folks who are listening to this episode and they say, hey, I want more information, or I'd love to work with that therapist, or whatever, how can folks find you and reach you? And any particular projects you have going on that you haven't already mentioned?
Yeah, my website is lpcsupervisor.com. My Facebook, I have two. I have at Fort Worth Counselor and at LPC Supervisor. And then my email is texaslpcsupervision@gmail.com. I pride myself on educating. I love educating. So I'm just gonna, my current projects are just to continue working on the way I interact with students, especially in hybrid platforms, meeting them where they are, and trying to provide really awesome and effective instruction to these grad students that are going to be our future counselors.
Right.
And then continuing to hone in on my skills, because you want a therapist or a counselor that is always working on themselves. So I am trying to stick to that model and work on myself. So my next goal is going to be to pursue the PMHC credential, so that I'm a little more legitimate in that world, and be able to open up and market myself to a population that has been underserved for a really long time.
Nice. I love it.
Yeah.
Well, I thank you so much for, again, just taking time out of your busy schedule to share with the audience, to share with me, giving me an update on the things that you're doing, because I'm always looking for folks to refer to.
Love it.
Number one, but definitely I think you touched on some very helpful things that folks listening may need to hear, right? About how many of us have experienced trauma, the benefits of EMDR, and some of the other types of resources and support that are available to them besides EMDR as well. And some of the work that you've done with trauma and pregnancy that may be surprising to some of our listeners as well. So I thank you so much again for your time, for your expertise, for your perspective on some of these topics. It has definitely been helpful. I'm going to try to include links to some of the resources that you mentioned when I post the episode, so that folks who are looking for help, support, and resources can hopefully take advantage of some of those things, like OpenPath, for example. So thank you all for hanging with us today for this episode of I Can't. This has been Dr. T. Remember, I support women of color who've accepted a narrative that there's something wrong with them making mistakes, and who are looking for ways to accept being perfectly imperfect and getting back to being their authentic selves. We look forward to seeing you on a future episode of I Can't. So thank you so much for your time today. And until our next episode, make it a great day. See you all very, very soon. Thank you for listening to the show. This has been I Can't with Dr. T. Don't forget to reach out to us on your preferred social media platform at Dr. T Medley on all platforms, Facebook, Instagram, Twitter, and TikTok, on the web, drtmedley.com, or by email info@drtmedley.com. Be sure to let us know what topics you'd like to hear and what you'd like to talk about on future episodes. Until next time, make it a great day.